actors, ballerinas, football players, soccer players. Yes. I mean, I've had a valedictorian come through my doors. So that's the thing, is that these kids are amazing and have so many strengths. And it's just a matter of supporting them and getting through the hard years right before like puberty and adolescence, and getting through that time period and keeping those strengths.
Being advocates for them to get to the other side of that.
We've seen this happen so many times, encouraging the parents and letting them know
it's gonna be all right.
Welcome to The Uptick, brought to you by the New Jersey Center for Tourette Syndrome and Associated Disorders, empowering children and adults through education, advocacy, and research by sharing the stories and experiences relevant to the TS community.
Welcome back to The Uptick. Today, I'm joined with Doctors Rockmore and Daniela Colognori, two clinical psychologists at Specialized Psychological Services in Short Hills, New Jersey. They both previously worked at the NJCTS Rutgers TS Clinic. It's great to have both of you on The Uptick.
Thanks for having us.
Thank you.
I'd love to learn a little bit about how you both got into Tourette's work.
For me, it started before, I guess, I graduated from graduate school. I was working at North Shore Hospital on Long Island. I was looking to do some research, and I got hooked up with Dr. Kathy Budman, who was an internationally known expert in Tourette. Getting to work with her and experience the patients that she was seeing, going to conferences and learning about her research, it sort of got me hooked a little bit, and I decided to do my dissertation with her. And part of that dissertation was going and interviewing 120 children and families who had Tourette's. So I got in my car and I drove around throughout the tri-state area. And after hearing those family stories, I was kind of hooked into the Tourette world. After that, I got roped into running the TS program at Rutgers, and that's history, I guess.
Love that. And then that was Dr. Lori Rockmore for our listeners. And now we'll hear from you.
Yes, I did my graduate work at Gazap at Rutgers. And so when you were at the time, I'm sure maybe it's different all these years later, but at the time they randomly placed you into your first field work type externship in the clinic, or internship into your first sort of clinical rotation at Gazap, your very first year. So I was randomly placed into the TS program as an incoming student. And that was really fortuitous or interesting to me because I actually have a experience with a family member who has had tics and OCD in the past. So I was really excited about it. But when I arrived in 2004 as a student, it was a really, really small, like babies of a program. And that was really right before NJCTS got involved. And so I went through my first year and we had some very small programming, mostly focused on supporting family members of kids with TS. When we were deciding about the second year, people suggested like that maybe I should stay on. I had expressed interest in that because they were trying to grow the program. And that's when I met Lori, actually. So she, in 2005, right? During my second year of like, hey, we hired someone who has a lot of experience in this area and we're trying to grow this program. And so Lori and I worked together, her as like expert content knowledge and me as like, oh, I kind of know what's going on here at Gazap at this clinic. That's how we met, started working together and tried to grow the program there.
Both of you still involved in Tourette's work as well and are at a clinic now in Short Hills. Is the Tourette population your focus, kind of specialty now?
Lori and I sort of would joke back in the day that like maybe one day we should go into practice together. And many, many years later that just happened. So we are partners in that practice along with one other doctor, Rob Happick, who also had done some TS work. So the three of us come from that foundation. And so while our practice is general, we serve clients with all sorts of comorbid things, and we all have slightly different backgrounds in other sort of specialty areas. But one thing that unites us is that we're all trained in working with families with TS. And that is, I would say, still a very large percentage of our practice, but not our only specialty area.
What we kind of have that like sort of differentiates us is that I think we understand families and individuals with TS a little bit more in depth than somebody who didn't come through the Tourette clinic. We have years and years of experience. We have hundreds of patients under our belt that we have seen who have tics. We also understand the comorbidities and the bigger picture of life with tics, just because we've seen so many individuals and families. When people come to us with Tourette's, it's just very familiar to us. Those patients walk in our door and we're just like, oh, we get you. And I think the patients feel the same way, that they feel understood. Some doctors, they may see like 5, 10 individuals with Tourette, and we could say we've definitely seen over hundreds. I think that's a big difference for us.
Incredible. Yeah, you're going to add something.
I was just going to say, I also think, so Lori and I have both served as directors of that clinic at Rutgers, obviously her for a long time. And she was my supervisor and mentor for a long time. And then I took on that role, and we often joke that we try to keep an eye on making sure that that clinic is continued to be run in the way in which the initial vision from Faith, a lot of the people at Rutgers that helped to get that going, started with. And I think one thing that we really have always focused on is we are not running a CBIT clinic or practice. We all do CBIT. We teach CBIT. We're big proponents for CBIT, but really try to be more holistic in terms of how we can serve and help and support individuals and their families. And I think that that is also one thing that both differentiates our current services as our practice and what we have tried to really leave as our mark on the clinic at Rutgers and the current leadership there.
No, I hear that. And the providing holistic care is so important. We've definitely had CBIT professionals on the uptick before, speaking and educating listeners on how that works, what it is. I'd love to hear a little bit more about what that holistic care looks like in your case. And I've noticed how you kept saying families as opposed to just TS patients or clients, because it is about all of the family. Having tics also affects my siblings and things like that. Would love to hear a little bit more about that comprehensive holistic care that you provide, and maybe some tangible examples of what that looks like in a session.
When we do our initial evaluation, we're always looking to see what is impairing the child in their environment first. We look to see what is the most pressing issue that they're coming into us with. And very often it's not the tics. It's more about functioning in school and how the accommodations that they might need in school, or how can they better be serviced by the school district and the individual teachers, the families in the home, sometimes the OCD, or it could be a big problem with inside the family for the siblings or for the parents, behavior management, sometimes working on ways to help the family sort of cope and manage behaviors that are impacting them getting out of the house in the morning, or sort of getting through dinner at night, or the activities that the individual is participating outside of school. So we really try to advocate for them and also make referrals to the NJCTS, to make referrals to Leadership Academy and the camps that the NJCTS runs, just to help them find other kids that may understand them and they feel that they're not so different. So we try to look more holistically and help the individual and the family meet the goals that they come into us with.
We're both moms, and I feel and actually it's interesting for me because I started this before I had kids, and it's when you're telling parents, you have to ignore the tics, it's really interesting coming at that from both sides of having kids and not having kids. And it's kind of the emotionality of watching your kid really struggle or be in physical pain or emotional pain from the tics. And I feel parents need a lot of support and coaching in how do I find ways to ignore that, or how do I find ways to make sure that I am attending to the other sibling or siblings while going through this really crisis time, if it's when a kid is first diagnosed, or just having a lot of bouts of tics or behavioral issues that go along with that. So really just trying to understand the situation from a family perspective and really trying to support families as well.
Yeah. And also these kids have so many special talents. And I think sometimes that gets overlooked by the tics, just athletic and intellectual. I mean, I've had kids that go on to Ivy League schools who go on to play professional sports.
Musical
talents. Exactly.
Yeah.
Drummers. Number of drummers that have been, it's so
you have to play drums. I mean, the breast reflexes and like just there's a musical giftedness to it. I found for me always, I don't know if you're either of you are musicians, but like sightseeing music, just putting music up in front of me and saying, okay, go start playing it. I've never rehearsed it. I've never read the music. Just give me the sheet music and I play it. I could growing up do that with very minimal errors. And I always felt like there was something Tourettic about that there was something in my Tourette's neuroatypical brain that allowed me to just process music like that, my brisk reflexes or something.
Yes, music. I think actors, ballerinas, football players, soccer. Yeah, soccer players. Yes, I mean, I've had a valedictorian come through my doors. So that's the thing, is that these kids are amazing and have so many strengths, and it's just a matter of supporting them and getting through the hard years right before like puberty and adolescence, and getting through that time period and keeping those strengths.
Being advocates for them to get to the other side of that.
We've seen this happen so many times, encouraging the parents and letting them know
it's gonna be all right.
All right. Exactly. It's just, this is a hard time, but getting through adolescence, getting through puberty, getting to junior year of high school, let's just hang in there. I'm pretty sure it's going to be okay.
Yeah, no, parents want what's best for their kids. It's always harder for the parents, in a sense, seeing their kid tick and wanting to do more, wanting to help them. And when I was diagnosed, honestly, I didn't think much of it. It was kind of, all right, it's something I have and do it. That was just my experience. But I think it impacted my parents more than me. I was glad to have an answer for why I kept twitching my head up and down, and why no one else was doing that in my class, but I still felt like me. Do you both treat adults with Tourette as well, or is your focus more on children and families?
Well, I mean, we see adults, not as many. A lot of adults, they've come to accept their tics. They kind of have fallen into a good groove with them. Occasionally, I think I find more Tourette patients, adult patients, come to us for the comorbidities. I mean, for me, I don't know about you, but a lot of people come in for the OCD, trichotillomania. That's really what I see most Tourette adults with. It's interesting because then some of them have children who start displaying some tics. I've worked with a lot of adult patients that have had Tourette and then go on to have kids that have some symptoms. So then I've worked on supporting them with that process. I'd say most of our practice is children, adolescents with,
I would love to hear a little bit of your thoughts on this broader topic of where we're at right now, the state of it. Where do we go from here? What you see as next steps to improve that?
What we're doing at Rutgers in the graduate program is extremely important. I will say that I am very, very proud of the students that I have trained, because they have really embraced the Tourette population and they have really understood why it's so valuable to have this knowledge to treat individuals with TS. I've always said that if you can treat a TS patient, you can treat any other patient, because there's so many, you learn so much about clinical psychology when working with individuals with TS, because the comorbidities are vast. If you can treat a complex patient, you can definitely treat a more simplistic one diagnosis situation. Basically, individuals with TS are extremely complex, especially the patients that come into the clinic at Rutgers. The patients that come into Rutgers are very complex in nature. I've always told my students that if you can treat the complexities of TS, you can treat patients who have one disorder or another. I really focused on training them on how to identify TS, how to identify OCD, how to identify ADHD, how to identify generalized anxiety disorder, panic disorder. We go through all the individual diagnoses and learn how to identify them, and then what the most efficacious treatments are for them. And then when you learn about all that, and then you actually get to experience it in the clinic with patients, they understand it. When you break it down in that kind of way, when you help them know how to diagnose and then what the most efficacious treatments are, I feel like they get it. And then they get hooked into TS. Most of my students that have gone through the program have stuck with it. I will say I pick up the phone and I call, if I can't take a patient, I say, oh, but I have Graham, or I have Michelle, or I have Mayor, or I have Jeremy, or I have Sean out in Oregon, or wherever he is. And I could just pick up that phone and call. And I know that we all understand these patients, and I feel comfortable referring them to anybody that has gone through the TS program at Rutgers. So I think there is a shortage, but I do think what we created is so important. It's something that I think should be replicated in other graduate programs. I think it would be a huge benefit to the TS population. There's a lot of value in just what you learn going through a program like that.
I think part of that too is learning how to see the big picture, right? Because of the comorbid picture, a lot of times it's really teaches you to try to understand what are the most pressing priorities or what will be the biggest bang for your buck in terms of intervention. What are we trying to target? Or like, if we can solve this daily problem that's happening, right? Like how much pressure that will take off other things, right? And have a trickle down effect. So I think it's really like a problem solving exercise too, in terms of figuring out where to prioritize your efforts, which I think was a really helpful tool. And I think is something that also generalizes just as a general good skill as a clinician to all individuals that you're working with. So I think that was an important piece of it too. In my time at Rutgers as director of the TS Clinic, I think that people are like, wow, they have a whole clinic for Tourette's, right? Because I think like in the general world population, it's not, people don't understand that it's common or don't understand that lots of people can have tics without having really visible TS in the way that it's portrayed in the media and things like that. And a lot of times students are kind of like a little skeptical maybe about like, oh, it's a whole clinic just for TS. And so I would always sell it as like kind of what Lori said. I use those lines a lot, like, oh, but you'll learn. If you are interested in working with children and adolescents, like this rotation is for you because you'll see every kind of disorder as a comorbidity throughout your year here. And that was my way of like getting them in the door. And then like Lori said, I think like most people just really loved it because they get a lot of experience, and these families are often, this is speaking to part of the problem, but have been looking for years or have been spinning their wheels trying to find a clinic or clinicians that were going to really be able to be knowledgeable enough and skilled enough to be able to treat them again, like as a family system and not just a C bit here or a little thing here. They're so grateful a lot of times for the services that they receive because they've spent so long trying to find appropriate care, and they're traveling from all over New Jersey to come there. Students who are trainees in the clinic grow to really like love it. And then now they have a specialty that not a lot of people have. And so they continue to exercise that. And we've created this sort of really informal network of our previous students in various places. It's grown in that way.
Yeah. And I think the students, some of them go on to specialize in TS, but some of them go on to specialize in OCD or in, TT or in eating disorders. But still, the foundations of what they learned in the TS program are continuing to be valuable because I get these phone calls and I get emails, especially around the holidays, from old students who are just thanking me for the training and the experience because they just feel like they have knowledge that is helpful for them in their careers.
It really is incredible. I mean, I would say we need these at all the states, partnering with more universities, just like you said, to have these practicums and clinics that are devoted to Tourette and co-occurring conditions to really dive into that. What's it like to be a practitioner in that space, being on the ground, doing that work and giving that training? About how many people were in a cohort or a class for the Rutgers program?
4 to 5.
Yeah.
Okay, so you get to know them pretty well, I'd imagine. Like,
and then some of them do stay on for a second year. So we would have 3 or 4 first years, and then they would have the option to stay on for a second year, right?
Sometimes. I think that
stayed on.
I mean, I just stayed forever. I think that's less rare now because it's like they have to get different experiences.
Okay.
But often there's also one postdoc who is there for more hours, and obviously it is more experience because they have graduated but are still trying to get their hours towards licensure. That has been a helpful training experience as well.
That's still going on?
I don't know. That's a good question.
One of the things I love hearing here is you both mentioned the need to prioritize when working with patients and really understand what is it that are the biggest challenges they're going through now and focus on that. I think sometimes we rush to help in the areas that we're able to help, and we may forget or overlook, okay, what do they actually need? What's going to move the needle the most in their life right now? How can I bring them the most value? And I'd love to hear a little more about how you do that. I mean, I know this is what you're experts in, and it's probably hard to just put in a concise little pithy podcast statement or two, but would love to hear a little bit about what goes through your mind when you're talking to a patient, trying to understand how best can I support them in school or wherever they are right now in life.
For me, it's identifying functional impairment. What is causing them? So if they are struggling in school, what is it? Is it their attentional issues? Is it their tics? Is it their OCD? We have all these different instruments we use. We do clinical evals, interviews, but we also do a lot of paper and pencil kind of interviews to really assess where there's the most impairment. And then also getting information from the parents, from the teachers, from the individual themselves, like identifying what do they think is causing them this problem. We see some families do come in strictly for CBIT. Parents will say that the neurologist sent them for this, or their pediatrician sent them because they heard about CBIT. And then the individual comes in and it's not really bothering them. That's not what's causing them the functional impairment. The parents are bothered by it. The parents have a hard time sitting through dinner but again, is that something that we should work on? And most of the times it comes out that we don't usually use CBIT for those kind of cases. If the kid themselves are not motivated or don't see it as being a big problem, then we really work very hard on trying to talk to the parents and look at other areas that we can work on that would make people more comfortable in the house or in the school. I do a lot of writing letters to the school district, going in and speaking with the teachers, with the, administration on how best they can learn to work with this individual who has tics so that the individual is learning to the best of their ability and the other students are not impacted and the teacher can teach to the best of their ability. So we really do try to work all together like that. But yeah, it's really identifying, getting the individual's input about what's impairing for them, speaking to the family and also speaking with the child's teacher. Or occasionally I've talked to coaches, I've talked to religious leaders, I've talked to just wherever this child is, what environments they're functioning in.
And I would say also like understanding each individual's, like the nature of their individual TS. There's so many examples where like a kid might have a lot of anxiety and like, for some people, anxiety kicks up the tics really intensely. For some people, that's not really a trigger for their tics. And so sometimes it's trying to understand, hey, like if I can treat the anxiety, not only will that maybe make a bigger impact overall in terms of their level of comfort at school or whatever the situations is, it also has the added benefit of it's probably going to decrease their tics some because they'll feel more in control of their anxiety and feel calmer, right? Or like I have certain kids where their tics are so impacted by sleep. Everyone is to some degree, but I have a couple where it's just like, I'll see them and I'll be like, how much sleep did you get this week? And so maybe we really need to prioritize what's going on at bedtime, or how can we look at like your overall schedule to make sure that you get enough sleep so that like you have less tics that get in the way, because that's something that, so that when I say kind of like bang for the buck, it's sort of like trying to understand their overall picture of symptoms and seeing that like, oh, well, maybe actually we could make the biggest impact in terms of your overall life and also your frequency or intensity of tics by targeting this other area over here that's going to have this trickle down effect. So I think that that's a big part of prioritizing as well.
Yeah, I would agree.
Yeah, I love getting to know the kind of the 360 view. What do the parents say, the coaches, teachers, family, but then also what's going to motivate the kid? Like you said, Lori, CBIT works best when you are committed to it, and I can say it's tough work to commit to that and be focused on it and practice the competing responses and all that. So if your heart's not into it and that's not what's you see as the challenge, then why focus on that? One thing I like to ask all of our guests on the episodes here is what advice you'd give to a Tourette patient. Would love to have both of you answer that.
Whoa, that's a very broad question. I think what I say to kids that come in is that the tics are only one very small part of who you are, and you are a whole person. And just like I have green eyes or I have light brown hair or whatever color I have these days, I'm not sure about it. It's just one small part of us, and you are pursuing your passions and doing what you love. If the tics are bothering you, we'll figure out ways, just like I could change the color of my hair. We can work on your tic. There are things that we can do to help you feel better. And it's such a small part that we don't really need to pay so much attention to it sometimes. Just live your life, be you.
Yeah. I always try to say, like, everyone has their challenges in the cards that they're dealt. And like tics sometimes are particularly challenging because they are out there and visible to the world. And when you feel like you're out of control, that's a scary feeling. But similar to what Lori said, that's just one part of who you are. That's your challenge to overcome how to still be yourself and be genuine to yourself and pursue what's important to you with this, in spite of this, and leaning into this. And I often tell parents, this wasn't exactly the question, but I often tell parents that, like, what I see over the years is sort of like a kid and a family's attitudes towards their tics is more important to the overall prognosis of how a kid is going to do in the long run compared to the actual intensity or severity of their tics. Meaning, like, I sometimes see kids with really out there, visible, intense, severe tics where we're just like, that's just me, right? And like, it doesn't stop them. It doesn't deter them. The parents are really able to get behind that and not worry so much. And like, they come out of it the other side, just themselves with tics. Versus some other kids where it's like, and families where maybe their tics are not really actually that visible or severe or intense, but they've just, for whatever reason, had such a hard time accepting it and being able to put it into perspective, and the attention on it and the distress about it can really like stop them from doing the things that they really want to do because of how they feel about the tics. And so I remind parents that a lot is in their control in terms of how the family integrates and accepts and finds a way to put it in its place.
I think they can do whatever they want to do. A lot of kids come into me and they just are afraid that this is going to stop them in their dreams and their ambitions. And I will tell you from all of my experience that I have seen kids and individuals with tics do the most amazing things. Going to Ivy League schools, playing, like I said, Division I sports, going to law school, becoming doctors, becoming researchers, neuroscientists. I've actually seen one of those, and that person will probably know who they are. I've just seen people do such amazing things, and there's no stopping you, really.
It's funny. One tangible example is like, I can't tell you how many kids and parents come in and be like, I'm never going to be able to drive a car. And I'm just like, yeah, you are. Learn how to drive a car, right? Like, and I can't like how many CBIT sessions I've had from them in the car. Like, I'm doing Zoom, they're in the car, and I'm like, okay, show me how this tic looks in your car. We're gonna find a way around it. Like, you can drive.
Most of my patients with tics, actually, when they drive, they tell me that they don't have.
Yes, that they're not able to. Well, they don't believe that, right. And so we have to get to that point, and then
the exposure.
Yeah, I do have a couple. I'm like, but look, you can just wait till the red light, or you can push against this part of the car. That's a really tangible example, I feel like, of like, what do you mean? Of course you can.
Any other topics or points either of you want to bring up? The floor is yours.
I mean, I think just we're so both, to speak for both of us, like so grateful for Faith and Rutgers and everyone that was involved in getting that clinic up and running and where it is today. It's been a really great opportunity for both of us to be in this world that not really that intentional on either of our parts, but don't know professionally or personally where we'd be without that, actually.
It's been quite an amazing journey, like getting here. We couldn't have done it without the support of the NJCTS and Faith Rice, who really
impacted us. Yeah. And all of the students, that get out of it are really due to her and her efforts and her persistence. And she was amazing.
Yeah, she was a pretty amazing woman.
Really incredible. Yeah, she was, and building all of this up. Well, thank both of you for being on the podcast episode here. I would love to speak with you again, and I wish both of you success in your professional endeavors. Hope you have a wonderful rest of your day here.
Thank you. Thanks for having us.
You're very welcome. And thank all of you for joining us on The Uptick.
Thank you for listening to The Uptick. Brought to you by the New Jersey Center for Tourette Syndrome and Associated Disorders, empowering you to stretch the boundaries to live your best life. The The NJ Center for Tourette Syndrome and Associated Disorders, NJCTS, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on this podcast. We do not endorse any recommendation or opinion made by any guest, nor do we advocate any treatment.